Macular degeneration is the most frequent cause of legal blindness in the United States. Approximately 25% of patients aged 70 or older are afflicted with this disease. We asked Dr. Small to explain what the macula is.
The macula is a very special part of the retina. And the retina is the film in the camera. It's what the light is focusing on in the back of the eye. The macula is very small. It's only about 5 millimeters across, but within that very small area is where the fine, detailed central vision is, which is reading vision, driving vision, etc. So it's a very critical part of human vision, particularly. And it's very important for independent living skills in humans. So the macula is a very critical part. And what macular degeneration is an aging degeneration of this tissue. And even a small amount of disease can cause a lot of problems with vision. Macular degeneration, first of all, the real name is age-related macular degeneration, which implies that the number one risk for macular degeneration is age. And that's one of the risk factors that we can't control, obviously, or want to control. Macular degeneration is the leading cause of blindness, irreversible blindness, in all developed countries throughout the world. Macular degeneration early on has no symptoms at all. In severe forms, it usually involves a central blind spot in the vision or distortion in the vision, things that should be straight door jambs, tiles that are straight start appearing wavy or crooked or distorted. And that's usually an early sign of wet macular degeneration. Dry macular degeneration actually is more insidious, with very subtle blind spots that develop in the vision over years and decades. And then very mild forms of macular degeneration have no symptoms at all. And that's why it's imperative for folks over 60 years of age to be examined very specifically for this with a fully dilated eye exam.
What are the treatment options for macular degeneration?
The treatment for wet macular degeneration has evolved quite a bit within the last 5 or 6 years. The primary treatment now is to inject medications into the eye, and that is the best treatment we have. And most people get a significant improvement in vision within the first couple of injections. 80% of my patients see a significant improvement within the first 1 or 2 injections. These injections are done on average of every 4 to 6 weeks, depending on which anti-VEGF agent I'm using. And the bad thing about these agents is they don't last forever. They wear off in the eye, and typically the patient need subsequent injections. But these anti-VEGF agents have revolutionized how we treat macular degeneration. It's been a great boom for our patients. One of the other current treatments for wet macular degeneration is called photodynamic therapy with a light-sensitive drug called Visudyne. This was approved by the FDA for the treatment of wet macular degeneration 10 years ago. And it was the first FDA-approved treatment for wet macular degeneration. It's an interesting treatment. Most of our treatments for macular degeneration, wet macular degeneration, are spin-offs of cancer research. And basically the idea is a light-sensitive drug called Visudyne is infused intravenously in the vein, and it circulates throughout the entire body. So as this drug starts to circulate through the leaky blood vessels in the back of the eye, we sit the patient up at the laser and put a little contact lens and focus this laser on the leaky blood vessels. We turn the laser on, the laser activates the drug. The activated drug then binds to some molecules in the blood, which then bind to the lining of these abnormal blood vessels, and then it thromboses them, it clots them off.
And what are the risk factors for developing macular degeneration?
The number one risk factor for macular degeneration is age. Number 2 is genetics. Number 3 is smoking. Smoking increases your risk for macular degeneration and severe macular degeneration by like 400 times. It's awful. Smoking is one of the worst things a human being can do to their eyes and their macula, not to mention the rest of their body. So smoking is awful, and smoking cessation is critical.
For more information on Dr. Kent Small and the Macula and Retina Institute, please call their Glendale office at 818-552-5040 or their office in Los Angeles at 310-659-2200. Or you can visit their website, maculaandretinainstitute.com.